distinguished guests, a very good morning once again. I can say that it's a very pleasant morning for me. So many busy days actually. I'm seeing a very good hospital which has served for more than 110 years. And many nursing students here for the future and hope of the society. It's my privilege. I'm truly inspired to learn about the ETCM's history. Just a man has explained me how the journey has been evolved over the years. So it is first time I'm seeing a very good hospital which has got more than 116 years. So I met our nursing superintendent ma'am also, who has served for more than 40 years here, right? So it's a privilege to meet you all. I'll tell a little bit about dialysis services. So as most of you know about the Apollo Hospital, which is Asia's largest hospitals network. So Apollo Dialysis is part of Apollo Hospital Group, dedicated for providing the dialysis services in India. So coming to the dialysis services, if you see the prevalence of kidney disease in India, in every million population there will be 800 CKD patients, chronic kidney disease patients, and there will be around 240 to 50 ESRD patients, end-stage renal disease patients, who require dialysis or the kidney transplantation. So here the issue is actually, I always say, that issue of 4 A's. One is the accessibility, second one is availability, third one is affordability, and fourth one is affectionate care. So because of this, there is a lot of gap in availing the dialysis services across India. So thanks to the government has taken many initiatives to address this problem. Government has started PMNDP, Pradhan Mantri National Dialysis Program, which is helping the people to get the accessible healthcare, especially for dialysis services in the last 7 to 10 years, which is a very good initiative. We are privileged to take part with the government in partnering with PMNDP, and we are providing dialysis services in many places, especially if you take Assam, Bihar, and AP. We are providing dialysis services in partnership with government, and we are privileged to partner with many good institutes like ETCM to join our hands with the institutes to provide the dialysis services across India. So at present, we are running closely 200 dialysis centers. We have a very big vision of expanding services widely across India and globally also. So that's why we have got a separate company called Apollo Dialysis Private Limited. So till now, we have sold more than 50 lakh dialysis sessions as on date. So and our vision is actually to move to the higher cities. So we have very good presence in cities, and we have many corporates are coming and working in the main cities. So our vision is going to the tier 2, tier 3 places. So I'll tell you one example. So we are working in Assam state. Assam state has population of around 3.7 crores. So in previous days, before 2019, where we started our dialysis services, in 2020 it is operational. The patients has to travel almost 150 kilometers up and 150 kilometers down to get the dialysis services. So it is a very tedious job for them, and every week they have to go three times in a week. So one is actually traveling time. We may mention about affordability, then availability, then accessibility. So government has taken the steps to set up the dialysis centers, and Apollo joined hands with the government, and we set up the dialysis centers across Assam. So we have around 65 dialysis centers in Assam. So we are there in the Guwahati city, as well as we are there.
Right. Thank you, Lara, Guli, for inviting me, and CEO, sir, the Dash, English, and my dear students. It's been a great privilege. As we know, ETCM is the pride of Kola, and more than 16 years of service, and it's very great service indeed, because as I am from transport department, as you know, we also work 24/7 by 365 like you people. Though it's not your level or your extent. And I'm also happy that we got a scheme called Aragya to tie up with your esteemed hospital. In fact, ma'am has been very instrumental in that agreement and providing service and treatment to our staff. I just want to say a few words about our KSRC Kola. We got about 2,500 staff here in the district with 5 bus depots, and we are operating around 2 lakh kilometers per day with 550 buses. We are serving 2.5 lakh people every day, not only in Kolar but outside Kolar, of course, Bangalore and other Longpoots. And we serve 75 lakh people per month. So many people travel, especially as you know, the ladies, they were free skiing, participation, and last week even for students was not made free, made students. So as per the government policy, so definitely we are striving to serve you better. We are getting many new buses. We got 10 buses last month, and next few months we will get another 40, 50 new buses. So it will help us to serve you better. And about your esteemed hospital and the treatment being given here. And today, sir has inaugurated this kidney dialysis unit. Even our staff have a lot of health issues, maybe due to age related and also some are habit based. After 40, life begins after 40. So definitely there are many students here and some are above 40. We all have our issues naturally or God given or whatever. But it's our duty to preserve it and like lifestyle. Our lifestyle is a very important thing. Everywhere we have pollution or whatever, there are many excellent factors. But persons who are doing having good lifestyle, life skills, and have good habits, even if they are 80 or 90, they are so energetic. Whereas other people who are quite young, maybe 30, 40 also, they look so dull, whatever. So I just request the youngsters here, many of them from other states also. I think you all learn Kannada also. I always tell wherever I go, you have to learn Kannada. When you are in Karnataka, you have to learn Kannada. I know many of them from Kerala. I do see many of them in the hotel and come for breakfast here. So I'm happy that you are here. Youngsters are always required for any industry and especially this institution. We have great doctors like Dr. Sir and other administrators and also youngsters like you. The new and form a formidable combination and this historical hospital. Earlier it was only, I think after COVID, after the expire, getting new developments and it's getting up to serve the people of Kola better. The sir was telling many grandparents or even the parents of grandparents, they have got treatment here. It's such a historical place. Getting a big momentum and ready to serve all of you. And even I do come here. Our staff also get treatment here, inpatients and outpatients. And especially I like the atmosphere and the cleanliness of this hospital. There's some hospitals which are I don't want to mention, but here always whenever I come, I can feel the vibes here and the calmness, the atmosphere, the cleanliness, and the staff working. It's a great learning curve. Even whenever we speak to our staff, we mention always the medical field. So we have to have that dedication, that hard work, the smartness or whatever. So that's very important. And in that, naturally, the medical staff, the doctors and the nursing staff, they always come first. They work so hard and even a small mistake, it will go a long way. So I thank you all for all of the great service you are doing. And I wish you all the best and from KSRC Kola and hope we can have a good combination and we also try to serve you better in the days to come. And also I thank once again ma'am Tara Modi for taking me giving me an opportunity to speak here. Thank you so much. All the best.
Respected members of the dais, respected members of the press, the students and all the people gathered here. I would like to welcome you to Wings ETCM Hospital and to this momentous morning that we are all gathered here. And like sir was mentioning that it's all about 4 A's and it's accessibility. So I can definitely guarantee you that Wings ETCM Hospital is accessible, especially because it's been there for so many years and people know about the hospital and the services that we provide are quite accessible. Second thing is availability and affordability. I think Apollo dialysis chain provides that. Not only affordable and available care, but also state of the art care. And, being there up there in equipment, being there up there in good practices and services. So that's affordability and accessibility for you, availability for you. And I can guarantee you that Wings ETCM Hospital will provide effective care to anybody. So I think it's a marriage made to be,
that we have come together as a group to start these services. And I wish on behalf of the CMP, I'm standing here on behalf, and I wish for opening of these services. And also, I would like to pray to God that many people benefit from this. Many patients who roam around looking for dialysis services, affordable, will come here and find it there. Thank you.